Welcome to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please welcome your host, Dr. Carri Drzyzga.
Hello everybody, and welcome to the Functional Medicine Radio Show, the only internet radio show dedicated to giving you real solutions to improve your health. Not only are they real solutions, but they're natural solutions as well, because as you know, the one and only true wealth you have is your health. I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc, and I'm committed to helping you find the root cause of your health problem, fix the cause with natural treatments so you can feel normal again and live your life to the fullest. Now today's topic is about, well, it's actually our part 2 interview with Morgan Toombs, practical information on medical marijuana. So let me tell you a little bit about Morgan. She is the nurse manager of Canada's first nurse practitioner-led medical marijuana clinic called Cannabis Clinic. She is a multi-published author, Humanitarian Award winner for exceptional nursing care, as well as an award-winning adult educator. Morgan is passionate about helping Canadians navigate the confusing medical marijuana landscape and believes that Canadians should have affordable and timely access to medical marijuana, even if they live in the Yukon. Morgan, thank you so much for being back as my special guest on the Functional Medicine Radio Show.
Thank you so much for having me. I'm delighted to be here.
So for the listeners out there, I'll make sure in the podcast notes that you can see the link to our first interview with Morgan. And in that interview, we talked about, some of the most common reasons people seek medical cannabis. Pain, anxiety, sleep are the big three. Answered questions like, does it make you high? Is it addictive? Will it make you, stupid and kill your brain cells? And do you have to smoke it? And then on our last interview, we also spoke about the licensed producer, and once you have that prescription in hand, like, what do you do next? So Morgan, with the licensed producers, you had said that they're like any other business, like they can only take so many patients on with the amount of supply that you have available with the different strains of medical cannabis. And so it's difficult to find a licensed producer that is still accepting patients. But then, like, what if you're the patient and you're on medical cannabis, you're feeling great, it's changed your health, for the better, and then, oh my gosh, they run out of that specific strain?
Yeah, that happens a lot. Well, not a lot, but a lot. So, absolutely. So a couple things with this. So first of all, not all licensed producers sell the same kind of medicine. So, switching one out for another may or may not be effective. So if a licensed producer happens to run out of medicine, and we had a patient recently where that happened, where I won't say the name of the licensed producer, but they ran out of their medicine, and the patient was like, what do I do? And they'd gotten the authorization document from their family doctor, and so they didn't know what to do. They weren't connected to a clinic to help get them connected to another licensed producer, and that's a whole ordeal if the patient doesn't have somebody advocating for them. It can be quite challenging for a patient. So, if a patient is on their own in that kind of way, they probably will not be able to get access to more medicine until that licensed producer produces more medicine. And think about it like this, right? Like there's a whole growth cycle that happens with medical marijuana. It's not something that they can just print more pills, at the factory. They need to grow the medicine, and then it needs to be tested and approved before it can be sold. And so there's a 3-month life cycle, a growth cycle for medical marijuana. And so they may be waiting up to 3 months in order to be able to purchase their medicine again. So that's a huge challenge for people that don't really know much about what their rights are, what they can do as a patient, and that there are other licensed producers that may have something similar, but it would be called by some other type of name. So again, that can be very confusing for a patient. patients can, though, if they either know how or if they're connected to a clinic, what they can do is sign a release document, and then the cancellation request would be sent to the licensed producer. The licensed producer would then release their script, and then the patient can put that script, or we would put the script on the patient's behalf with another licensed producer that has a similar medicine. So, for example, if somebody needs a low THC CBD product and only in an oil, if one licensed producer runs out, then we would search through the different licensed producers that are currently accepting new patients, have oil, and CBD oil specifically. Then we would talk to the patient about the price if that works for their budget, and then we would connect them with the licensed producer that is able to do that. Then it would still take it would take anywhere from 3 to 5 days to get the patient registered, and then they would be able to order their medicine. So so it's happened before. I'm sure it'll continue to happen where licensed producers run out of medicine for short periods of time while they're waiting for their growth cycles to come to fulfillment. It definitely is a barrier in the industry.
So that just sounds like a ton of work that the patient would have to do on their own. And so you help fill in that gap because it's a lot of paperwork.
Well, it's a lot of paperwork, and it's a ton of paperwork, and the patient can't register with another licensed producer until they get that release document from the licensed producer that they're currently with. And then what do? Well, they have to then go back through the list of licensed producers and discern which ones are, one, public-facing, ones that actually sell to the public, and two, who are accepting new patients, and three, that have a similar product to the medicine that they were getting at the other licensed producer. And what we do as a clinic is, if we know a patient is getting benefit from something that's, for example, a 1-to-1, so 1 part THC, 1 part CBD, then we would look at another licensed producer that has a similar product and a similar profile, that a terpene profile that would give the patient very likely similar benefits.
And then you have to switch them to that, start at low doses, titrate up to the dose that works for them. Yeah. It's if they've been getting success on the previous medicine at a certain type of dose, then we could start closer to there. We wouldn't necessarily have to start them at the exact lowest. If they were doing it by themselves, I would definitely say start at the lowest, simply because we wouldn't know exactly like what that product is and how it would be interacting. Like if that makes sense. Like we'd want to keep it low for sure, but they wouldn't necessarily, if they're being monitored, start from the very lowest dose. They could start with where they just a little bit lower than where they were started before, because it would be pretty much the same product. Okay, so now we know that once you get your prescription, that you go to you have to get it to a licensed producer. You don't go to a dispensary. You don't go to some random street corner or behind some building and get it from a street dealer. Yes. And so there's a whole process with that. So I think next, a lot of people wonder, can they get fired if they're using medical cannabis? Right. Yeah, this is such an important question because it's confusing for people. Like, it's marijuana. What's my boss going to think? Well, first of all, if you're a patient with diabetes and you need to take your insulin, you're not going to get fired for taking your insulin, period, if you need to take insulin during the day. And so with a patient who is a medical cannabis patient and they're using it for medical purposes, which is what all medical cannabis patients do, and they need to take it during the day during work hours, it would be, best practice, I believe, to have a conversation with their boss if they have a product with THC in it, because THC can be, it is the one that causes that high feeling for some patients. And so the main thing is to ensure that the patient is able to be fully functional at work and to be able to have access to their medicine. So their human right is for them to not get fired. That being said, if they're taking a product that could potentially cause them to be impaired, like THC, then they would need to, either do it in such a way where they wouldn't be impaired, so microdosing, or they would need to have a conversation with their boss to let them know, hey, like, I'm not going to be impaired. These are the criterias, and like have that type of conversation to ensure that the worker is able to work effectively even while being on medical marijuana. And there's a lot of patients that we have that are very concerned about that. And so, for pain patients, for example, so a patient who drives for a living,
then they have quite a lot of pain from sitting in a stationary position for such long periods of time. They get quite a lot of pain, and so we have them put the CBD oil topically on the areas of pain, and they've been getting quite a lot of relief. And so that in and of itself during the daytime is really effective for them. There's other patients that have a lot of anxiety, and so they take an oil in the morning, just a CBD oil. So it's very, very, very low levels of THC, typically less than 1%, and then high levels of CBD, which is a non-psychoactive and an anxiety-reducing cannabinoid. And so they'll take it in the morning, and they'll just need to dose once during the day, and they feel great all day. We have other patients with anxiety, one that I'm thinking of, anxiety and PTSD, they microdose with a CBD vaporizer all day. So they'll just take it whenever they feel that they need it, because with vaporizing, it smells like marijuana, because marijuana is marijuana, and it has that aroma, if you will. And so it's, for that patient, they just communicate with their boss about that. It's just a CBD product, and we send them, we support our patients a lot. And so we send those patients where they have those types of concerns, information, and, the human rights, like what's been written about it already in different provinces around the country. And, all of it makes logical sense. Like, you would not get upset with a person for taking their diabetes medicine. Why would you get upset or fire somebody for a patient who's taking their anxiety medicine, or topically putting on their pain medicine, or ingesting their pain medicine? Like, it does not make any sense. As long as the person is able to do their job effectively, then it really should be a non-issue.
But what about these industries where they do routine drug testing?
Mm-hmm. Yeah, that's a really good question. I don't really know how to answer that. We're still in lots of different conversations with organizations that do that. So that's definitely a fear. Like, even with a CBD product, if a patient is taking just a CBD product, and THC is typically what the urine tests are testing for, THC, which is the one cannabinoid that causes people to feel high. Because in a CBD product in Canada right now, there is no licensed producer that is currently producing a CBD-only medical marijuana strain. There is a trace elements of THC. So depending on the urine test, they may test positive even though they're only using a CBD product, even though they've never gotten high or felt that euphoric feeling. And so that's, I think there's a lot of work to be done in that area, and a lot of policies to be written and communicated to, us as a public at large, and also within in the organizations themselves. Because on one hand, why would you want to be having, patients in pain and not being as effective at work, or, being really stressed out because their body is in so much pain, or they're so anxious, or they're not sleeping well. And then have it be like a big penalty for that if they're taking something that's more natural with a lot less side effects than the pharmaceutical meds. There's a lot of work to be done there.
And you had said, it would be good to have, sit-down conversation with your manager, your boss, whoever it is, to have a very open, transparent conversation about this.
Yeah. And I think, again, because there's a lot of stigma still around marijuana, it takes a lot of guts to do that. And I think it is really best practice to sit down and have that transparent conversation. And we're happy to support. We will send our patients whatever they need and links to resources, because again, it's so hard to know what to search for in Google, first of all, and then, what are credible resources. And so we support our patients. Like, if anybody even from any of your listeners, if they want information about that, I'm happy to share resources with you that you can share with them, because it's definitely a very it's a big deal, and I believe that patients should not be fired for using cannabis, as long as they're able to do their job.
Of course.
Yeah.
Okay, so we've learned some of the effects of medical cannabis. Now, let's talk about side effects.
Mm-hmm. Yeah. So there's, like any medication, there's side effects. I always like to start, whenever somebody asks me about side effects, I like to tell a little story. So a colleague who works in a medical cannabis clinic was telling me about this phone call that she received, and she picks up the phone and, hello, so-and-so clinic. And a woman says, I don't know what to do. on the phone to the receptionist. I don't know what to do. And so, of course, immediately alarm bells started ringing. And she's like, oh my gosh, in her head, she's like, oh my gosh, what do I need to do? Do I need to tell her to call 911? Should I call 911? What's going on? So the receptionist says, okay, well, what to do about what's happening? What's going on? And the wife says in kind of a lowered voice, my husband, he's taking medical cannabis and I just don't know what to do. And she's like, oh my gosh, like, what's going on? Do you want me to call 911? She says, no, I don't want you to call 911. He's dancing. Can I give him more? And he's dancing, and can I give him more? Well, this patient was a 86-year-old man who had been chair-bound for many, many years, and he'd been taking cannabis for a while, and finally he was feeling so good and mobile, and he was, flirting with his wife again, and being really playful. He was dancing, and she was like, oh my gosh, this is the man that basically what she was saying, and I don't know what to do, can I give him more? Basically, she reconnected with the man that she fell in love with, and he was dancing all over the place, and and so that's one of the side effects, of course, is joy, increased feelings of well-being, increased mood. It can also cause dry mouth. It can cause sleepiness. Essentially, the side effects are a lot less than almost all the other pharmaceuticals out there. What I love about cannabis, from a nurse's point of view, is that there's no lethal dose. There's no recorded in thousands of years of a lethal dose of medical marijuana, or marijuana, period. There was a gentleman who has a PhD in this, and he was in the States, and he did an image, like an infographic of how much marijuana a person would need to consume in order for it to be potentially lethal, and it was 1,500 pounds or kilos. It was a lot of weight, and that would have to be done in 5 minutes. So it's consuming 10 to 20 times your body size in 5 minutes is almost impossible.
I don't even think they can do that at those hot dog eating contests.
I don't know. I'm pretty sure they wouldn't be able to do that.
Okay, so it's extremely safe.
It is extremely safe, yeah.
And I guess if you're on the wrong strain or the wrong dose, you might not feel so good.
Yeah,
but that's part of the that's part of the niceties of working with a clinic like Cannabis Clinic, is that there's somebody there on the other end of the line that's kind of walking you through what to do if you're not feeling good.
Yeah, absolutely. And, if patients have never tried marijuana before, we don't start them at a high level of THC. We don't even know how they're going to tolerate THC. So it's about starting a patient nice and low and going really slow as we up the dose to their lowest effective dose. And so, I like what you said about the wrong strain. For sure, we don't, what's really great about working with a clinic, and even we have a lot of different patients with a lot of different ailments, and so we know what works for what typically works with patients. So 40% of our patients with this particular condition really benefit from using this, and so a good chunk of the time it works really, really well. And so, or if that doesn't work, then this works for, the other 40%. Okay, great. And if that doesn't work, this works for the other 20%. We work with our patients to ensure that they find what works. And, and the wrong dose piece, my gosh, again, it's all about starting a patient nice and low, going nice and slow. The image in my head is about, just imagine holding a little granny's hand, walking, her through the whole process, because we want to avoid any of our patients feeling scared about using marijuana as medicine. It's good medicine, and there's good evidence that supports, marijuana as being very helpful for a lot of different people. So,
So Morgan, do you know how many different strains of medical cannabis are out there?
I don't know the exact number, thousands though. There's a lot of different types of strains. There's, if we're talking globally, if we're talking Canada-wide, I'd say each licensed producer has anywhere from 5 to 20 on the market at any given time, and those are in rotation, and there's 57 licensed producers right now.
Okay, so that could be 20 times 57, which is, I don't know, but it's a lot. and so that you, as a health provider, that you have a patient, that needs medical cannabis for pain, and that you guys already kind of have a general idea of what strains work best for that, generally.
Yeah.
Which strains work best for anxiety?
Yeah.
Which strains work best for sleep, for nausea, for blah, 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 blah. And that part of just navigating that is huge. And then, like you said, you mentioned before microdosing. What exactly do you mean by microdosing?
So it's taking just a tiny little bit. So it would be microdosing would be through a vaporizer. So the differences in terms of delivery mechanism is oils, which is typically used sublingually, so underneath the tongue. It takes longer for it to fully integrate into the system, so about 2 hours to feel the effects, but then it lasts for a lot longer, so anywhere from 6 to 10 hours depending on the patient. So that is not a microdosing tool because of the long-lasting effects of it. Whereas with flower, which is the bud, like the green stuff that you would put into a vaporizer, typically like in the past what would be in a joint, we use vaporizers now in 2017 and beyond. And so with microdosing, it's when you're vaporizing, it crosses the blood-brain barrier almost immediately. So the effects are almost immediate. They last for a lot less time, so it happens right away, the effect happens right away, and then the patient is receiving benefit for anywhere from an hour to 4 hours. So so instead of taking an oil dose once or twice a day, microdosing allows for just like one little puff to get symptom relief without getting stoned.
So then really it sounds like that depends on what the patient's complaints are.
Correct.
As to the delivery mechanism, what's going to work best for them. They might be fine on the oil sublingually. They might be fine on oil topically. Mm-hmm. They might occasionally need a vaporizer. It really just depends on the patient. But like, is that written on the prescription, or is that part of what you do at your clinic?
Oh, that's such a good question. So we used to, when we first started, we had a lot more criteria on our prescriptions or our authorization documents. Because all the different licensed producers sell different things, and not all of them sell flower, meaning the bud. Some of them sell oil, and then a couple of them sell different unique products. Like one sells a sublingual spray, one sells powdered, like decarboxylated cannabis, so like pill form. Some sell pills, like oil capsules. So it depends. So patients.
Now Morgan,
yeah.
I noticed you did not say edibles.
Right. Good ear. Yeah. So edibles, patients can make their own edibles for sure. Edibles are available in dispensaries. Again, I would strongly encourage you not to go into a dispensary because you don't know what you're getting. But if a person wanted edibles, you could make your own, like brownies or chocolates or what have you. I recommend that more for an experienced user, though, because what we want to do, again, is about starting the patient on the lowest dose possible and then increasing it to be the lowest, most effective dose. Mm-hmm. And so we don't know in a bite of a brownie, how much marijuana is in that bite. And so because it's an edible, it's going to take longer for it to impact the system. So, waiting 2 hours to get the impact from eating a brownie, like who wants to sit there with a brownie staring at them for 2 hours and to discern whether or not they're going to be taking another bite? So yes, edibles are not legally allowed in Canada yet. The closest thing to edibles is oil. And so most of our patients, bar none, are on oils. We cater a lot to the senior demographic and people that are scared of or very hesitant about the stigma that is associated with, or was associated with the flower or the vaporizing or that whole thing. So oil doesn't have the same type of stigma. So that's very, the closest thing to an edible as possible.
Morgan, before we got on this recording, mm-hmm. You told me a story about one of the patients mm-hmm. That required a walker when they first came in. Can you share? Do you mind sharing that story with our listeners?
No, for sure. I'd love to. It's a great story, and there's stories like this is my favorite part of my job is these types of stories. Like they pour in every single day, and it's amazing. So this patient is a patient of a colleague of mine who's an anesthesiologist, and so this patient came in, lots and lots and lots of pain, had 2 aides, so 2 people on either side plus a walker. So came in, none of the treatments were working, none of the conventional pain treatments were working. This patient was very senior. And so the doctor puts the patient on cannabis. And so 3 months later, follow-up, patient comes in with just a walker, no aids. So obviously already an improvement. And so, the doctor sends the patient away, and patient comes back 6 months later, and the patient doesn't have a walker, doesn't have any aids, and is sitting there tapping her toe, pointing to her clock and says, "Doc, can we please hurry up? I got to go dancing." This is like an 80-something-year-old woman, yeah.
Mm-hmm. So people use medical cannabis for many different reasons, and you had said earlier that Cannabis Clinic really just tries to smooth the experience for patients, and the patient education and the follow-up care, and should just treat the patients like they are a family member.
Yeah. The Cannabis family, yeah.
Morgan, these two conversations have been so great. You've provided us with so much information. Is there anything we've not touched on at this point that you think is important?
I think what's important is for patients, if people are wanting to get access to medical marijuana, there's just understanding what the process is, like what the different options are, and just to be aware of if a clinic charges, if a clinic doesn't charge, what are the things to be aware of, like what's a good buyer's manual, if you will, on or like a checklist of things to look for when you're wanting to get medical marijuana, because there's a lot of different pathways to get to the end result. It's really about what specifically does the patient want, and what is the outcome that they're wanting. So I'd love to chat about that if there's a bit more time.
Yeah, absolutely. Go right ahead.
Okay, cool. So a lot of doctors, MDs, are not comfortable prescribing medical marijuana because of all the follow-up care and for a variety of other reasons. And so a patient can go to their doctor and get print out from the Health Canada website an authorization document. Your doctor probably will not have that in their office. So if you print that off for them and you take it to your doctor and she signs off on it for you, then what you would do at that point is you would fax it to a licensed producer. So make sure that you do your research and find out which licensed producer has the right strains for you, so that you can actually order your medicine. We had a patient, and why I'm bringing this up, I had a patient this week who got an authorization document from their doctor in June, and they're a cancer patient. And so in June, now it's June, July, August, September, October, November, 5 months later, the patient still hasn't received any medicine. The patient didn't know. Wow. I know, wow. And it's a cancer patient. I know. Wow. And so the patient didn't know what to do, so they printed out the Health Canada sample authorization document, sent that over to Health Canada, not realizing that Health Canada doesn't need that. So they sent the original copy to Health Canada, and then they're like, okay, well, what do I do? Now, they thought they were registered, but they weren't. And so we get a call this week about it, and so we're like, okay, we'll expedite you and make sure you get your medicine. So we actually have to do the whole process again: get the patient, get them seen by the nurse practitioner, get them connected to a licensed producer, get them registered, and then get their medicine sent over. So 5 months late, but at least we can get them with their medicine in hand by next week. So there's a lot of steps to do. It's definitely possible to do it on your own, though, if you want to just go in and have your doctor sign. Just be aware that your doctor probably will charge you about $40. That patient paid $40 for their doctor to sign that form. So whatever your doctor's fees are for filling in forms, that would be the charge. So typically anywhere from $20 to $60 would be pretty standard across Canada. So that's one way, is the DIY, do it yourself. And then if you're doing it yourself, there's a really good website I'd check out. It's lift.co, lift.co, and there's information about different strains. What I love about that website is that it's non-solicited reviews, and so they're medical cannabis patients that will give reviews about the different strains. One of the flaws that I find about that website is that not all of the strains are always available. So it gives all of the different strains that have been available, but they may not still be available. So understanding, knowing how to look at what's in the cannabis itself, and then being able to translate that into something that is available in a licensed producer right now is a skill. It's a good thing to to do. And you're welcome to call our office and ask us questions if you guys have questions about that. And then the other options are just things to keep in mind, like best practices is if you're covered by like OHIP, we live in Ontario, so OHIP typically covers in-person physician visits for patients. So the patient doesn't need to pay out of pocket for that. Oftentimes, though, there is a fee, like an administration fee, anywhere from $60 to, I've seen like $199 to $250. And that's just for the administration fees. So just to send the stuff off to the licensed producers, just to do a little bit of conversation with the patient. That doesn't include follow-up care with any clinic except for ours. And so there are options out there. But just to be aware, just because something's covered by OHIP, it doesn't mean that there's not going to be other fees. And I think a lot of people don't realize that. And then even if there's absolutely no administration fees, if it's just a free clinic, what we're finding, we're getting a lot of patients from free clinics coming to ours because they have to chase after the clinic to get an appointment.
Okay.
Because they're so busy, so they're having to, like, the patient has. So you were asking earlier about, what does a patient do if they run out of medicine? Well, what does a patient do if they can't get another script? Mm-hmm. And so they can't get their medicine without another script. So so just to be aware of that, and I would book appointments, each time that you're there, like book it like right there in the now to make sure that you have a continuance of being able to get your authorization document. And you're going to have to go in. It'll probably take about 3 hours each visit, and it will be probably for 3 months. Unfortunately, right now the space is really about maximizing OHIP payouts. And so, they see patients every single 3 months, and, the authorization document is allowed to be for 12 months. And then there's like our clinic, for example, we are a fee-for-service clinic, and we've got three different tiers. We have the $50 model, which is a DIY, but we get the script for you, and we pay all of our nurse practitioners out of pocket. We are not a covered service, like we are not covered by OHIP yet. So that's a DIY. The next model that we have, it's $147 to get, it's a starter pack, and it has like an education session with one of our educators, 1 month follow-up care with our nurses, and a script from our nurse practitioner, and as much conversations and things that you need in order to titrate with the right medicine and all of that kind of stuff for the first months. And so we find the majority of our patients are pretty good. The majority of our 30 to 45-year-old patients who've typically used recreationally are really good with that package. Because even if they've used recreationally, like self-medicated, and Carri, I think you're going to be surprised at this, there's a lot of patients that have been self-medicating with marijuana for years. Yeah, there was a doctor in Toronto who did just polled his patients to see, well, should I get into this space or not? Like, do my patients even need this? Polled his patients, and 30% of his patients that had the courage to tell him that they're self-medicating with medical marijuana told him. So I think the number is probably a bit higher than 30% if those were the patients that he was actually able to communicate to and they actually had the courage to share. So so even if a person has been self-medicating with cannabis, there's a lot of different things to know. Like, you can't go to a dispensary. You're not going to get medicine there. You want to order from a licensed producer that has the right medicine and the right delivery system for you, if you want oil or if you want sublingual spray or if you want topical or if you want flower. So there's a lot of information, and so we find there's a lot of our patients in the 30 to 45-year-old range that fit that. And then we have a 2-year package where it's 2 years. Everything is you'll always get your scripts. You have every single month a nurse will be calling you to follow up and make sure that you're okay. If you have any questions, you've got unlimited access to our team. So we have a very, very robust follow-up care. We give a beautiful patient journal to those patients to ensure that they're able to document their medicine and be really interactive with it. It's beautiful. I think you've seen the journal. It's beautiful.
It's very nice. Yeah, it's very nice.
And so that one is $299, and it's all inclusive for 2 years. So, and then all of our patients are lifetime patients of ours, so we're always there, and we have like an a la carte menu to cover the costs of our service providers.
So then, Morgan, if patients want to get involved with Oak Cannabis Clinic, do they need to be referred by their medical doctor, or can they self-refer?
That is such a good question, and that's one of the big barriers I find about physician-led clinics is that they have to have a referral. We don't have to have a referral. We are happy to take a patient who is self-referring. Like, what we're finding is a lot of patients, even our 96-year-old patients, have brought cannabis to their doctor, and their doctor's like, no, that's the last thing I want you to be on. But that's the last medicine I want you to be on. Try everything else but that. And so really at the end of the day, we were talking about in our last interview about the 4 pillars of good clinical based evidence. Well, 50% of that is patient's preference and patient's experience. Yeah. So, the patient's preference should be honored. And because it's such a safe medicine, when properly monitored, I think, my personal opinion is I think it should be, first line, but it's not framed that way in Canada yet. And so, patients do not need to get a referral from their doctor. We're finding a lot of patients having a lot of obstacles with their doctors. And so we are happy to take patients who self-refer. The criteria, though, they do have to pass, we have a screening process, and they have to pass that in order for us to be able to work with them as a patient. They do need to be a legitimate medical patient. They need to have tried something else, and and either the side effects are too much, or it's not working. The medicine is no longer working. We've been getting a lot of patients who are wanting to find a more natural alternative to what they're using is working, but it's not a long-term option for them. So they want to find something else while they're not experiencing a lot of other side effects. Come to us to get a script. So so you don't need to get a referral for us. You can self-refer. Just you do need to have a valid medical reason to be coming to work with us.
And then you had said that as a nurse practitioner, mm-hmm. they can do the actual prescribing. You don't have to have a prescription from the medical doctor, right?
Correct. Yeah. So in Ontario, nurse practitioners are able to prescribe medical cannabis, and so you don't need to have a physician prescribe. Nurse practitioners can prescribe. Yeah.
Okay, Morgan. Thanks again for being on this interview and sharing all this information. Again, can you share the website for O Cannabis Clinic, and if our listeners want to find out more about you, how can they reach out to you?
Great. So our website is ocannabisclinic.com, just like our anthem, ocannabisclinic.com, and just the letter O. And you can reach me there and my team there, or you can send me a private email. It's morgan@ocannabisclinic.com, and just put in the subject line that you're one of Dr. Carri's podcast listeners, and I'm happy to respond personally or direct you to the team member, one of our social workers or nurse practitioners or nurses or other team members that can help you.
Fantastic. The question that I did not have a chance to ask is, what do you think is going to happen when it becomes legal? When that day comes, what's going to happen after that? Well, that will be our third interview topic.
It's an awesome question, and we're actually really excited about it becoming recreationally legal. So I'm happy to do a third interview with you for that when we do.
All right, Morgan, thanks again for being my special guest today. This has been an awesome interview.
It was my absolute pleasure. Thank you so much for having me.
All right, that wraps up this very special episode of the Functional Medicine Radio Show with Morgan Toombs. And I want to thank you, our listeners, for tuning in today. And I'd like to invite you back next time for another episode of the Functional Medicine Radio Show. As always, I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc. Have a great week, everyone.
You've been listening to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please tell your friends about the Functional Medicine Radio Show, and we'll see you next week with more from Dr. Carri.